In the United States alone, cardiovascular disease causes roughly 700,000 deaths every year, making it the leading cause of death. And each year, approximately 805,000 Americans suffer a heart attack. What's even more surprising, many of these events occur in people who never believed they were at high risk, which raises a critical question. Are heart attacks truly unpredictable? Or are we simply missing the warning signs? Preventive cardiology is built on 5 major components: risk detection, major risk drivers, lifestyle interventions, advanced screening tools, and preventive medicines. Let's start with the foundation. Heart disease rarely begins with symptoms. In many cases, warning signals exist years, even decades earlier. Standard cholesterol panels are helpful, but cardiovascular disease is driven by deeper biological processes occurring silently within the arteries. But blood work is only part of the story, because later we'll discuss a test that detects actual plaque, not just probabilities. If a first-degree relative developed premature heart disease, your own lifetime risk may be roughly 2 times higher. Genetic risk can exist even when routine lab values appear normal. Diabetes is one of the most aggressive accelerators of cardiovascular disease. Patients often face a 2 to 4-fold increase in cardiovascular event risk. Nearly half of adults in the United States carry a diagnosis of hypertension. Among patients who suffer a heart attack, a large proportion have a history of elevated blood pressure. Chronically high pressure promotes plaque formation and plaque instability. You may not feel your high blood pressure, but your arteries certainly do. Atherosclerosis is fundamentally driven by circulating particles capable of entering the arterial wall. Higher particle burden means greater exposure and higher plaque risk. When people imagine heart disease, they often picture arteries slowly narrowing over many years. But most heart attacks do not occur because an artery gradually closed. They occur when a plaque suddenly becomes unstable. Some plaques remain quiet. Others become fragile. When a vulnerable plaque ruptures, the body forms a clot that can abruptly block blood flow. This is why heart attacks can be sudden and unexpected. Inflammation strongly influences whether plaque remains stable or becomes dangerous. Most heart attacks are not random events. Large studies suggest that 70 to 90% are associated with modifiable risk factors, meaning cardiovascular risk is often detectable and changeable, which leads to one of the most powerful pillars of prevention: lifestyle interventions. Regular physical activity is associated with approximately a 20 to 30% reduction in cardiovascular mortality. Movement itself is medicine. Diet influences inflammation, blood pressure, lipids, and metabolic health. Even modest improvements can alter cardiovascular risk. Smoking directly damages blood vessels and accelerates plaque formation. Stopping produces profound cardiovascular benefit. Even modest weight reduction improves blood pressure, triglycerides, and metabolic signaling. Stress and sleep strongly influence cardiovascular biology. Recovery is a preventive intervention. Unlike blood tests, the coronary artery calcium score detects existing coronary plaque. A score of 0 suggests very low short-term risk. Higher scores indicate increasing plaque burden. Statins reduce major cardiovascular events by roughly 20 to 30%. Additional medicines provide further risk reduction in appropriate patients. These medicines do not simply change numbers, they save lives. Most heart attacks arise from measurable, identifiable processes. Preventive cardiology exists to intervene before catastrophe occurs. If you liked this video, don't just take care of your heart. Show the video a little love too.